Hello, my name is Dr. David Harari, and I'm the president of Reproductive Sciences Medical Center. I'd like to welcome you to RSMC's LGBTQ Family Building Options Seminar. Here at Reproductive Sciences Medical Center, we like to consider ourselves as your partner to join with you on your journey to create a family. As President and Chief Medical Officer of Reproductive Sciences Medical Center, I'm very interested in helping people with their fertility concerns. I spent much of my career doing fertility surgery for many IVF centers in San Diego, utilizing minimally invasive techniques such as laparoscopy and robotic surgery to treat conditions such as endometriosis, fibroids, and other gynecologic conditions. Additionally, I'm a member of the American College of OBGYN, AAGL, and ASRM. Of particular interest for me is also diminishing ovarian reserve and aging reproductive potential in women, as well as utilizing assisted reproductive technologies for single patients, same-sex couples, and others that are transitioning and desirous of creating a family. Joining me at RSMC are other fertility experts, including Dr. Min Ho, who is our medical director and has had over 30 years of experience in IVF. He specializes in helping patients that have had previous IVF failures and has had a great experience in individualizing treatment protocols for every unique situation in the infertility space. Additionally, we're joined by our lab director, Dr. Kevin Ohm, and Dr. Kevin Ohm has had a very long career in reproductive medicine. Additionally, he spent over 10 years at Columbia University heading up the embryology division of their IVF department. At this point, I'd like to play a short video to give you an overview of our great facility. You know, you deserve to achieve success on your path to parenthood. RSMC strives to provide a seamless journey by offering all of the resources that we have here and care to help you build and grow your family. Our mission statement is really to be concerned about delivering quality service with the utmost professionalism and compassion. That is our objective. We're dedicated to working together to create a sustainable and competitive advantage that leads to create a leader in the industry. I feel confident knowing that with the help of our highly skilled specialists, you can expect to have the best care possible. So let's talk a little bit about what you can expect when you come visit us here at RSMC. Well, one thing, we start with a nice medical consultation, which takes about 30 to 45 minutes, and we'll review your fertility history, prior treatments if you've had any, what your concerns are, and what your plans are for your family planning goals. The fertility evaluation is a 15-minute physical examination, and it'll also include an ultrasound. Additionally, while you're visiting with us at RSMC, we'll have you meet with our financial coordinators to basically inform you in a very transparent way what the costs are of the treatment plan that we develop together, and also to review your insurance benefits to see if there's any possible coverage that can be garnished from your insurance. For attending the seminar, you actually will receive a free ultrasound or a semen analysis for coming to visit with us. So let's discuss now what options you may have. So let's talk first about understanding your options, and these are options for individuals or couples with a uterus and eggs. We have the ability to give you access to a sperm donor, which that donor may be an anonymous donor or a known sperm donor, depending on your situation. We offer intrauterine inseminations And the IUI cycles that we do are both done as a natural cycle or a superovulated cycle, if you will, using fertility medication. Additionally, we offer IVF services for women that are experiencing fertility issues. And we also have done co-IVF. And this is where we utilize an embryo that is created from parent one and actually transfer that embryo into the uterus of parent two. Let's talk now about the options that are available to you if you're an individual or a couple with sperm. We have an egg bank and can offer fresh as well as frozen egg donation. We also have done split insemination with 2 partners, sperm through intracytoplasmic sperm injection, or ICSI. In addition, we also have our sister physicians surrogacy agency, which is one of the largest surrogacy agencies in the country, and we'll talk about that in a little bit. Additionally, at RSMC, we have options for transgender men, female to male. Before transition, the use of testosterone can cause significant changes in your body. And for transgender men who still have a uterus and can carry a pregnancy to term, but they'll need to come off of their testosterone therapy. Egg freezing is an essential part of the family building option for transgender men who intend to use the eggs to create a biologically related baby for them in the future. We also offer at RSMC options for transgender men, female to male. If you are single before transitioning, and starting androgen or testosterone therapy, there is an option for you to conceive through IUI using a donor sperm. If you're partnered with a cisgender woman, you can use your own frozen eggs to actually form embryos, and these are implanted into the uterus of your partner, who can carry them to term. This is a reciprocal IVF or partner-assisted IVF. You're also going to need a donor sperm in this case, and we have that available. If you are partnered with a cisgender man, your partner's sperm can be inserted directly into the frozen eggs during ICSI, and you can utilize the surrogate to carry the embryo to term and deliver a baby to fulfill your family planning and creating needs. If you're partnered with a transgender woman, treatments will include using your frozen eggs, which can be inseminated with a donor sperm or your partner's sperm if that is available to produce embryos, and they can then be transferred into a surrogate for a full-term pregnancy. If you're partnered with another transgender man, your frozen eggs can be inseminated using your donor sperm to produce embryos. The resulting embryos can then be transferred into a surrogate, again, who can carry the pregnancy to term. Options for transgender women, male to female, is sperm banking. So if you're considering growing a family before undergoing hormone therapy or gender confirmation surgeries, sperm banking is an essential step that you will need to take. If you choose to freeze your sperm after starting hormone therapy, you would require a short pause in that hormone therapy prior to collecting a specimen in order to produce good results. If you're partnered with a cisgender woman, the simplest option is natural conception through sexual intercourse. If you or your partner is facing an infertility problem, we can perhaps even use your own health insurance benefits for treatment costs. Options for transgender women, male to female, after hormonal transition. If you are partnered with a cisgender woman, pregnancy is attempted using your sperm to fertilize the eggs of your female partner. This is done via IVF or intrauterine inseminations, which is IUI. So let's talk for a moment about IUI or intrauterine insemination. In the IUI process, you may begin by taking fertility drugs and then have your ovulation cycle monitored very closely to see how many follicles are developing in the ovary. Donor sperm can be used, and this sample can be specifically washed and prepared for the insemination. This does two things. This washing will improve the motility and also concentrate the count of sperm for the specimen that's going to be transferred into the uterus. And this is done with a catheter. It's a very simple procedure. It takes a couple of minutes to take place. Let's talk for a moment about IVF. In IVF, it comes in several steps. Step one is to stimulate egg production using hormone stimulation protocols. Once we do this, we retrieve the eggs from the ovary. This is done transvaginally in our center. We then take a sperm sample which is provided, and in the laboratory we fertilize those eggs one by one with a single sperm chosen by the lab director through a process called ICSI or ICSI. Once we create the embryos, we grow them to 5 days in the laboratory, and these 5-day embryos called blastocysts are then transferred into the uterus through a frozen embryo transfer. This slide will illustrate what the appearance of the ovary is after a stimulation protocol using the fertility drugs. And each of those black circles represents a follicle, and each one of those follicles contain one mature egg or oocyte. As you can see from the illustration below, the eggs are collected through a transvaginal aspiration that is done under ultrasound guidance using a vaginal ultrasound probe. The entire process takes about 20 minutes, and we use a MAC protocol, which is a heavy sedation, so that it's a painless procedure. You wake up 20 minutes later and the eggs are collected. This photograph shows how we stabilize one oocyte, one egg, at the end of a pipette, and then we actually inject the sperm directly into the egg. And doing this procedure, ICSI, we have over 90% fertilization success rates in our center. Here is a video in our laboratory showing of an actual ICSI procedure. This overview of IVF options for females really goes over all the potential ways we can help you create a family using eggs of partner A, donor sperm, and putting the embryo into partner B to carry. We can use the eggs of intended parent, donor sperm, and put the embryo into a surrogate. If you're a single person, we can utilize donor eggs, we can utilize donor sperm, and again, put the embryo into an intended parent. We also have utilized eggs from intended parents with donor sperm and transferred those. So there are many different options available to you in terms of what we have to offer. For IVF options for males, we have the ability to have you select donor eggs and use sperm from one intended parent and put an embryo that is created back into a gestational carrier or a surrogate. Additionally, you can use donor eggs from the agency and fertilize those eggs with the sperm for both intended parents and have the surrogate carry. Generally, we recommend that we segregate that process so that we understand exactly what the genetic nature is of the embryo that's created from each of the sperm donors or intended parents. The purpose of this slide is to give you an overview about how important it is in terms of the age of the eggs that are being utilized. You can see that the normal embryo creation or normal blastocyst percentage is highest with younger egg donors under 35 years. In fact, in our egg bank, 28 years is the cutoff. And generally what happens is the number of normal embryos that are created goes down with age, so that by the time an egg donor or an intended parent who's utilizing her eggs who's over 35, you can see considerably the number of blastocysts, normal embryos, really goes down due to genetic abnormalities and, chromosomal abnormalities in these embryos created. At RSMC, we have the ability to deliver fertility preservation for our patients. So when you come in, we do different types of tests. This includes blood tests for ovarian reserve testing, such as AMH. We will check progesterone levels, FSH, LH. These are all hormones that are made by the pituitary gland and can affect ovulation process. We'll do an ultrasound evaluation looking for antral follicle counts to check your ovarian function. And we also do infectious disease screening such as HIV, hepatitis B and C, gonorrhea, chlamydia, STD testing, etc. This ultrasound image shows you what the ovary looks like when we do stimulation protocols on it during an IVF stimulation cycle, and look at the number of follicles in this ovary that are growing. They're all very uniform, and each one of them contains a mature oocyte at the time of the retrieval of those eggs. Fertility medication includes a pre-treatment cycle. We generally use birth control pills for about 20 days. And then once the period begins, we start to give you injections of fertility medications such as Gonal F and Menopur. And these medications are given daily for a period of 8 to 11 days. This calendar is a good representation of a protocol that we are administering, and we very clearly have our coordinators give you a roadmap so that for that period of 2 weeks that you're undergoing IVF stimulation, you'll have very clear instructions on how and when to take your fertility drugs, as well as when to come back into RSMC for your ultrasound and laboratory evaluation, which occurs about every 2 to 3 days. During that time, you'll have blood tests done. We will measure the follicles as they grow, and we can determine when the right time is for you to have a trigger shot, which happens 36 hours before we retrieve your eggs. I mentioned before the egg retrieval process is done in our surgery center under ultrasound guidance, and you are under anesthesia during that time, so you won't experiencing any pain. Once the eggs are removed on the completion of the retrieval, you spend about an hour after the procedure to recover in our recovery room, and then you can go home. The whole procedure takes about 15 to 30 minutes max. We also do egg freezing for those individuals that want to preserve their fertility, and that includes doing a stimulation protocol, monitoring their follicle development during the stimulation protocol phase, and then doing a transvaginal aspirate. One thing I would like to mention is in the laboratory, when that transvaginal aspiration of the follicles is given to the lab director, the embryologists in our lab will actually evaluate these eggs prior to freezing them and let you know what the quality is of these eggs and whether or not they are mature. Once the eggs are retrieved and identified, they're individually labeled and stored in these types of tanks. These tanks use liquid nitrogen, and they can maintain, the eggs can be maintained safely and frozen for many years, as can the embryos. Each one of these tanks is locked under security and are being monitored on a 24/7 basis for functionality. You know, egg freezing has become extremely popular in the United States now, and we're very transparent about the pricing of all of these procedures associated with egg freezing so that you know exactly what it's going to cost before you get started. I think it's critical when you're evaluating a fertility center to make sure that you have on-site lab director and a real quality laboratory to increase the successful outcomes of collection of the eggs as well as fertilizing of these eggs. All of our ultrasounds are being done by our physicians in RSMC, not by physician extenders or technicians, and we really adjust our protocols on an individual basis. Embryo freezing is done at the optimal time, day 5, occasionally on day 6, and again, we categorize all of these embryos in terms of their quality before they're frozen. Our prices are all very transparent, and you can see this comparison slide showing our prices versus other IVF centers. Due to the COVID-19 coronavirus pandemic, we heavily discounted our egg freezing prices through the end of the year, and I would encourage you to take advantage of that as well. We do a lot of third-party reproduction at RSMC. Just to share a thought with you, not being biologically related to a child does not make you any less of a parent. And certainly being a parent is not just in the DNA, but it's in the heart of the journey that you're taking for that child. With our third-party reproduction pathways, our patients can utilize fresh egg donors, they can utilize frozen egg donors, they can utilize sperm donors, and we have our sister agency providing us with a huge number of gestational surrogates available to carry your baby. The third-party reproduction journey is somewhat of a complicated one, and there are definitely legal implications. We have attorneys that we work with here at RSMC with egg donors, intended parents, and everything is done in a legal fashion under a legal contract. The donors of eggs can remain anonymous and confidentiality is respected. Again, intended parents get legal representation, as do the donors on either side, to maintain legality and transparency. Egg donors eligibility, they're usually between 19 and 30 years of age. Actually, 28 is our cutoff in our egg bank. The BMI of the egg donors is less than 28. All egg donors are screened for STDs as well as genetic carrier testing. A detailed family medical history is obtained. They're all non-smokers, and we evaluate them for mental health as well. Our preference has always been to use fresh egg donors over frozen egg donors because there's a slightly higher success rate associated with the utilization of matched fresh egg donors. And the number of eggs when you purchase frozen egg donors are usually limited to a half a dozen or 8, whereas if you match with a fresh donor, all the eggs that we obtain from the egg retrieval in that cycle belong to the matched intended parents. Brief overview on gestational surrogacy process. Eggs from an intended parent or donor eggs and sperm from an intended parent or donor sperm are used to create an embryo in our IVF embryology laboratory, and then that embryo is transferred at a later date to a surrogate after a specific preparation of her uterus, and the journey then begins. Our sister physician surrogacy agency has very strict criteria for how they vet their surrogacy candidates. All surrogates are usually between 21 and 37 years of age with a BMI less than 32. They must have had at least one child of their own and no previous pregnancy complications. All of the records are reviewed extensively from their previous obstetrical records. They must be non-smokers, have no criminal history, and undergo a background check. So we really screen to make sure that there's no medical condition that might endanger a future pregnancy or carrying your baby through that journey. You know, why do people consider surrogacy in the United States? Some people have a medical indication. For example, women that have had previous surgery on their uterus, have fibroids or scarring, or have had a previous complicated pregnancy which would endanger their lives to carry a baby again, for example. For some of our patients, they're of advanced age, and there are higher risks of complications such as gestational hypertension and diabetes that can occur, so they want to avoid the personal risks. Or, you know, for obviously some people that can't carry a pregnancy, our male patients, for example, same-sex couples will be using a gestational carrier to carry out their childbearing journey. As with egg donations, there are definitely, when it comes to gestational carriers and surrogacy, legal implications. Usually 2 different legal counsels are involved, one representing intended parents and one representing the surrogate themselves. And these contracts are legal contracts that are bound, and also the implications on birth certificate. For example, if you use a gestational carrier to have your baby, when your baby's born, the birth certificate will not reflect the name of the gestational carrier or surrogate, but rather the name of the intended parents only. Generally, there are two types of surrogacy, commercial and altruistic surrogacy. The altruistic one, the surrogate does not receive any monetary compensation for carrying the baby. Usually they do it for a family friend or family member. The problem with altruistic surrogacy is sometimes complications can occur, unforeseen expenses can occur, and generally intended parents feel like they're not in as much control as when you go through a commercial surrogacy where everything is clearly laid out, very transparent, all legal contracts are in place, and generally there's compensation afforded to the gestational carrier through an agency. Regarding international versus United States surrogacy, I definitely have some concerns because the quality control is not quite there with international surrogacies. There may be legal implications bringing the child back into the country. The standard of practice of medical care really can vary from one country to the next. And the responsibility of these international agencies may not be as forthcoming. Also, you have to worry about the transport of the embryo and what effect that's going to have on the quality of the embryo. In the United States, I think there's some higher costs associated with surrogacy than, for example, international surrogacy, but there's a much more extensive screening process that's done, very transparent legal contracting, and standards that are set by the American Society of Reproductive Medicine. Very good quality control there. I mentioned our surrogacy partner, Physician Surrogacy. Besides being one of the largest in the United States, they are the only agency that is OB managed, meaning there is physician oversight to the agency, and I think this is a very important distinguishing factor. The other thing that makes physician surrogacy so desirable is there's only an average matching timeline of a week, there are no fees charged to the intended parents until a confirmed match is made. You certainly have many choices in utilizing agencies that are available, and there are so many here in Southern California. This slide can give you a cost comparison of physician surrogacy costs versus some of the other agencies out there. And again, I think the fact that it's a medically supervised and managed agency plays a big role in why I think you should select physician surrogacy. So why choose Reproductive Sciences Medical Center? We're a one-stop service model, if you will. And one-stop shop basically means that we have a very segmented industry with each treatment handled by different providers, and we really wanted to revolutionize the whole process to help our patients navigate their family creation journey and put it all under one roof. That's what the solution is that we provide at Reproductive Sciences Medical Center. I think it's very different than other IVF centers. The advantages of RSMC are shown on this slide. Our relationship with one of the largest surrogacy agencies, our individualized use of over 40 protocols for our patients, the fact that we have great success rates and a state-of-the-art laboratory. We also have the availability to do genetic screening of the embryos called PGD, and we also have an on-site laboratory under the guidance of an on-site lab director. These are all very important advantages. Our embryology laboratory includes an andrology department, and we have a very controlled environment with quality control parameters being evaluated on a daily basis. And I really believe that the critical success of an IVF program is really dependent on a well-run on-site a full-time lab director and laboratory as we have at RSMC. This really ensures the best success rates possible. I want to thank you for joining our seminar today. I look forward to meeting all of you. Come out and visit us, have a free consultation, and I'm confident that you'll be impressed and we can help you recognize your dreams of creating a family. Thank you very much.